So there's girl math, boy math, and this is nurse math. If you bring your lunch to your shift, you will spend about $15 in the cafeteria. If you don't bring your lunch, you're probably only gonna spend like $6. You are a one-to-one in ICU, you have one patient, you are going to have a hell of a shift. If you have 4 patients in PCU, med-surg, fine, great shift. If you have 5 or more, thoughts and prayers. If you are working Thanksgiving day shift, you are going to be depressed, but it's going to be really slow and chill. If you are working night shift on Thanksgiving, you will also be depressed. This will also be the most critical patients you have ever seen in your life. If you're working daylight savings time, night shift in the spring, your shift will actually last 6 hours. If you're working night shift, daylight savings time in the fall, your shift will last 45 years. If one of the parents is a nurse and they have an older daughter, the eldest daughter will be a nurse. No exceptions. If you have one rapid response or code on your shift on your floor, you will have another. Never one.